They kept the entire Sydney cider alive during the pandemic. They hold degrees, save lives, and work 12-hour shifts. But here's the harsh truth: many Sydney healthcare workforce, about more than 80% of them, can't afford to live where they work. Sydney's house price has just hit 1.7 million Australian dollars, according to Domain June 2025 report. So if you say, you don't want to buy a home, you want to rent instead, that will be $780 a week for a modest home. When you say, okay, I don't want to rent a house, maybe a unit, okay, that's just a $40 different. It is $700.40 per week for a unit. So that's the most expensive rental market in Australia. So let's talk about income. A Sydney-based registered nurse, as an example, earns between 1.5 and 1,500 Australian dollars and 1,950 Australian dollars a week, depending on their seniority level. So how about a pharmacist? Yes, a pharmacist roughly about 2,050 a week if they are lucky. Okay, if they are lucky. Okay, that is the amount. So to put this into perspective, that means up to 52% of nurses' income goes to a rent. And the pharmacist, around 38% if you are lucky enough to earn $2,050 per week. I would say that number is very generous. It's much lower than that. In case you forgot, if you're spending more than 30% on rent, is defined as housing stress. So I've looked in other healthcare professional. I looked into physiotherapy, which is one of my profession. I also look at other profession as well. It is actually a problem, big problem for capital city in Sydney. People who are healthcare workforce, nearly 80% of them cannot afford to pay to afford to live in Sydney. They cannot afford it. So let's talk about, can someone in this profession buy a home? Not a chance. Buying a home for 1.7 million Australian dollars Sydney house, you will need a whopping 340,000 Australian dollars deposit and still owes 2,150 a week in mortgage repayments. 2,150 in mortgage repayment. That means even a pharmacist cannot afford it. Let's say, for example, the mom and dad gave them money to pay that deposit. They would still need to pay 2,150 week for a mortgage. So even our best paid healthcare workers would need over 100% of their salary just to make repayments. Alone, forget it. Dual parents or dual income or rich parents, maybe. Like I said, banking mom and dad, when you have a rich banking mom and dad who can give you maybe 1 million Australian dollars money to pay as a deposit. So at least if you're earning around that amount of a pharmacist, maybe you would then be able to have a mortgage of 700 Australia 700,000 Australian dollars. That is a chance. That's how you can buy a home in Sydney. So everyone else is out. Yeah. So what does this really tell us about Australia? What this says about Australia? This isn't just Sydney problem. It's a values problem. If nurses, pharmacists, or other healthcare professionals who care for our communities cannot afford the roof over their heads, what kind of society are we building? So, as a result of this issue, Australians are fleeing Sydney for cheaper cities. And yet, we keep importing migrants into this housing mess without fixing wages, planning, or infrastructure. And we are told you need to thank us, you need to thank healthcare workers, the heroes. Maybe it's time we pay attention to the healthcare workforce, whether they have enough to live with dignity. It's not just healthcare workforce, I think, and even other professional public service people we need. They would still be facing the same problem. This is MzansiOz Diary, where we connect the dots, amplify the silence, and call out injustices whenever it hides. Like, share, and subscribe if you agree. A healthy society starts with fair housing.